Good afternoon, everyone. I want to thank you to the Montgomery County Executive Recovery Revitalization Town Hall. On behalf of County Executive Mark Elbert, we want to thank you for joining us today. First of all, let me say that we have a simultaneous interpreter with us, and I'm going to turn it over to Ms. Lev for some instructions for our other non-English speaking viewers. Thank you, Ms. Lev. I appreciate that. So we do have a lot to discuss today. It's been a while since we have spoken to this audience, so welcome back. A lot has been going on in the last 3 to 4 weeks. We'll get right into some grant program information that hopefully you will find useful. About a week ago, the County Council approved for the Business Rental Assistance Program grant to be active. It is going to be about $1 million. We are having it administered by our partners at LEDC. We are grateful for them and thank you as always. The grant program will be up to $10,000 or 3 months worth of rent, whichever is less. The small businesses that are eligible for this retail related program have to be located in Montgomery County. They have to have revenues of less than $500,000, showing a loss on their tax returns from 2019 to 2020. The online portal administered by LEDC will be up and running in early May. The applications will be up for a week, and then priority rankings will be done, including economic distress that will allow them to be awarded. It will not be a first come, first served basis. It will be a little bit more strategic than that. And then distributions will be made directly to the tenants beginning in early June. This program, and thanks again for Councilmember Will Juando and his staff, has been coming for a while. So we thank them for their persistence in ensuring that we are providing this sort of relief to those who need it in this time. Speaking to our partners at EDC, I think a lot of you are aware that they have successfully administered at least 3 or 4 programs, and they are working on the parameters of 2 programs right now. One is the restaurant program, which is another, I believe is $3.9 million, and the nonprofit program to help out that community, which is $3 million. So they have a lot going on. So we thank them, and by the next time we speak again, we should have some information for you that will allow you to understand the parameters of those programs, who to apply, when to apply, and everything else. We do know and recognize that reopening has occurred, and there are capacity limits that are allowing people and businesses to get back into action, so to speak, but we still want to make sure we keep our eyes on these programs that provide financial relief to those who are in need. So thank you for listening to that. And having said all that, I will now turn it over and begin with Dr. Gales, and he'll be followed by Dr. Stoddard, and we'll talk about what's going on in the public health of the county. And please remember to put your questions in the chat, and we will make sure we get to them after we hear from our subject matter experts. Thank you both for joining us.
Good afternoon. Excuse me. Good afternoon and happy Friday. I will say Sylvia Kench is in the waiting room to join us. So whoever has controls, if they can let her in.
Please let her in.
Yeah, she can be a part of the conversation. I will keep my remarks brief and save room for questions. Thank you for the opportunity to be here with you all. Things are very fluid right now on a lot of different fronts. And I know lots of folks are asking, well, why aren't we, the core question that we've seen in some of the questions submitted, why aren't we moving at the speed of others, and what does that look like for us? To be perfectly candid, the state's numbers are increasing, and we are at higher levels of community transmission than the first wave of the pandemic, the second wave of the pandemic, not quite as high as we were during the winter months when we saw the third wave. You know, that is influenced by a higher percentage of variant cases, particularly the B117 variant, which is also known as the UK variant, which is the predominant strain of COVID-19 in the state of Maryland. And a couple of things are a little bit different now than where we were before. When we look at hospitalizations, we see hospitalizations both in terms of acute hospitalizations increased, as well as to a lesser degree, the level of ICU related hospitalizations. When we look at back from a temporal perspective, When we look at where we were on March 8th, the day that the governor made the decision to open things up more significantly across the state to where we are now. At that time, the test positivity for the state, I believe, was around 3%. It is now just shy of 6%. And at that time, there were no counties over 20 cases per 100,000. Now, I believe that number is 8 or 9, with 5 counties in the red zone, meaning that they are over 25 cases per 100,000, including Baltimore, which is at 41, I believe, Baltimore County, which is over 25, as well as Harford, Harford, Cecil County, and one of the Eastern Shore counties that I'm blanking on right now. And there are a host of other counties, including Anne Arundel, that are not far from the 25 cases per 100,000 threshold. The state in itself is at 23 today. As point of comparison, the test positivity for Montgomery County remains on the lower end. I believe we are 22nd out of 24. And in terms of our case rate per 100,000, we are just over 11.6 cases per 100,000, I believe, as of yesterday. And it's gone back and forth between 11 and 12 over the last week. So the level of restrictions and reopening provisions that we have in place, we feel confident are what are driving our numbers to be where they are in comparison to other jurisdictions. And also one of the things that we're looking at is how we will factor in the percentage of those who are vaccinated into those decisions in terms of guidance to move forward, or however we need to move in terms of particular activities that are open. Now, on the vaccine front, if anybody has been paying attention this week, you know that we've had a little bit of a busy week when it comes to vaccine allocations. There have been a couple of incidents that have happened that have influenced our allocations and allotments. The first thing that I would reference is last week, there were some issues with the manufacturing of the Johnson & Johnson vaccine that caused approximately 15 million vaccines that have been expected to be delivered to not make it through. And as a result, the state saw a 33% reduction in the number of doses that they received. That trickled down to us as a local health department, as well as to the supplies available to other entities, including pharmacies, hospitals, as well as the mass vaccination sites that have been stood up. Since our last conversation, we have seen a mass vaccination site be implemented here in Montgomery County on the campus of Montgomery College, Germantown, and we have been providing doses there for several weeks now. Now, that transpired over the weekend, which influenced the amount and the type of doses that we received this week. The Johnson & Johnson doses have been slated to primarily support those mass vaccination sites across the state. Now, when we woke up on Tuesday morning, we found out that the FDA and CDC have provided guidance to pause the usage of that vaccine due to 6 out of 6.8 million doses administered, 6 cases associated with a rare type of blood clot. Now, the Commission for Immunization Practices is reviewing that information. They met once this week on Wednesday late afternoon and provided more details yesterday. And they are in the process of gathering more information to determine, one, if there is a causal link between the vaccine and those episodes, and if not, what the next steps will be. If it is, what the next step will be, and to find out exactly what that causal link is to determine if the vaccine can be safely used in the future and how it would be used and what types of populations it would be used for. We are awaiting further information from them and from the federal government to be able to provide next steps in terms of if we're able to use the vaccine and how we will be able to move forward. In addition to that information, the CDC has also released clear information that vaccines work. I believe in a conversation this morning, Dr. Stoddard referenced out of the 77 million doses administered across all of the different types of vaccines, there have been, I think, 0.0008% of those folks contracting COVID and a comparable percentage of those requiring hospitalizations. So the vaccines work, they're doing what they're supposed to do, and we are exhausting our doses as we get them and getting shots into the arms of our residents. We are hopeful And this is a point of reference. We're looking at a couple of other states who have actually implemented those types of strategies to influence reopening. One that I would point to that has good metrics is the state of Illinois. And let me caution you, those are states making those determinations. We have not seen a similar determination here in the state of Maryland. I will stop there in terms of updates, turn the floor over to Dr. Stoddard, but happy to answer any questions you all may have. Thank you.
Thank you, Dr. Gales. I don't have many comments. We obviously are making a few changes as well to additional guidelines. I think you will have seen pool guidelines updated to essentially a 50% opening of pools on the county website on Wednesday. We're working with the county council around graduations. They're continuing to discuss the certain implications of face coverings during extreme temperature. So as the warm weather hasn't gotten there yet, we're all still, it's a little cool today, but as we get a little warmer over the coming weeks and months, we obviously need to have certain accommodations in place for significant outdoor activities and exercise while it's extremely hot. So we're working on that. And a few other things are in the offing as we get more questions, and the council asks us to, as the Board of Health asks us to address certain issues or give recommendations on certain issues. And so there's that. And then obviously on the vaccine front, we just received word that actually we're seeing another reduction in the vaccine for the mass vaccination site next week. We're only getting about 4,700 doses for the site next week, which is about 20% less than we got this week. So obviously we'll be determining whether we're going to be closing the site for a few days or just doing less vaccinations on days and spreading them out. But obviously this is not the direction we want to be moving in terms of vaccine. We want to be having more vaccine than the week before progressively. But obviously with the Johnson & Johnson challenges and pause and the slow to increase other vaccines, I think we're sort of left at the mercy of what the federal allocation is to the state. And the state obviously, is reacting to what they get, and it's certainly causing challenges on the ground level, and we'll slowly we'll slow things down a bit. So that's all I wanted to cover. I don't know if Mitch has any comments before we take questions, but thank you all for being here.
No, thank you. We appreciate it. Great information from both. I will go ahead and ask a few questions, and there's a few questions in the chat, so we will get right into it. Dr. Gales, you mentioned about hospitalization rates within the county. Are we at a point where we're nearing our capacity by any chance for those being hospitalized in Montgomery County?
No, we're not in the red zone for capacity, fortunately. And like I said, we're continuing to monitor those trends. Our hospitalizations have increased, not as significantly as the state, but we have seen a slight increase in those numbers. But fortunately, as best as I can recall from the data yesterday, none of our hospitals are in the red zone as we speak.
Okay.
I did take a look at this, actually comparing where we were in December to where we are now. We're about, for COVID specific hospitalizations, we're at like 50%. But the thing is, we've also opened more things up. And so the hospitalization rate for other reasons has increased. So people are, we have more car accidents, we have more other reasons for people to go to the hospital. And so that is also impacting it as well. So it's sort of a, it's a little bit of a reshuffling of some of the caseload, but we have certainly seen an increase in hospitalization over the last couple of weeks as more things have opened up as well.
And speaking of reshuffling, next question is, are we still following guidance for second dose timing? We're not turning second doses into first doses, right?
That is correct. We're still following the appropriate schedule, and we have not reached a point where we are shifting second doses for first doses.
All right. Any data on contact tracing and testing trends, especially by racial and ethnic groups, completion of interviews, rate of testing?
Yes, we do get that information. We get actually lots of reports from the state. Again, the state oversees the contact tracing database COVID link. And we do get a series of weekly reports that break down the information that's provided in the interviews that they conduct in terms of, and we also conduct too, so we have contact tracers who work in concert with the state, but that information shows us the, the number of interviews, the time to completion, the percentage completed. It also breaks things down for a local perspective as well as a state perspective in terms of the types of venues and exposures that folks are reporting who test positive.
Okay, thank you. Very helpful. Next couple of questions are revolving around J&J and supply. Are there communication materials in development for people who have already taken the Johnson & Johnson vaccine? Are they safe if they haven't had a reaction yet?
Yeah, so there's multiple layers to that question. So there's information being put together at multiple levels, the federal level, the state level, as well as locally. The message that we've promoted to folks is, one, again, to emphasize that there have been just shy of 7 million doses of the Johnson & Johnson doses administered. And based upon the phone call yesterday that was led by the FDA and the CDC, that as of yesterday, they had only had 6 of these cases reported involving these blood clots. Based upon the information that has been released so far, and again, this is just what has been reported to date, is that there were 6 individuals. They were all women, between the ages of 18 and 48. We don't have, further information about their specific medical histories has not been released and shared to give any type of indication if there are any other type of predisposing factors that might have caused or enhanced those particular reactions. The majority of those 6, I want to say 5 of the 6, either 5 or all 6 of them, had what is described as a cerebral venous sinus thrombus. 2 of the individuals had a portal vein thrombus. And what's meant by that is that thrombuses are basically clots that form and cluster in vessels that can either block the vessel or also pieces of it break off and spread to other parts of the body to cause potential blockages or complications. And so what we've been doing is saying, okay, until we get further information, one other thing is the information reported is that the women who had those clots developed them between 6 and 13 days following the administration of that dose. Okay. And one of the reasons why ACIP we speculate they have said, well, we're going to wait until we get further information, is that there was a significant amount of doses of Johnson & Johnson administered over the last 3 weeks. And given that 6 to 13 day window, we believe that they want to follow that out to see if there are any other cases that are reported. As of yesterday, there have only been 6. There have been none reported in Maryland and none reported in Montgomery County residents, as best as we can tell. Now, the last piece of that is what we're hoping that folks at home who have received the vaccine understand is to say, if you develop these symptoms, including the traditional ones of the side effects, particularly a headache, back pain, shortness of breath, coughing up of blood, if you develop any of those symptoms following administration of the vaccine, particularly within those 6 to 13 day period, to please contact your physician. So we're providing that guidance to those who have received it. And the state has sent out a letter to healthcare providers to make sure that they're monitoring for those symptoms. And if any of their patients come in reporting that, whether into their offices or their hospitals, to report that information to the CDC so they can further study.
That sounds great. One of the piggyback questions that sort of ties into that is some people are waiting for the long-term effects of the vaccinations. Are waiting to see if people have adverse side effects. Is there any data from the first wave of people who were vaccinated worldwide that we've learned anything from?
Well, I think that of the 77 million who've been vaccinated here in the United States, that the 6 cases reported of the clots are probably the most severe instances of episodes. Again, it has not been proven that there is a relationship between the vaccine and the clot. And The other side effects for the other vaccines out of the 77 million, again, have just been more minimal allergic type reactions that folks have experienced as side effects. But when you start to look at, I guess, and I'm not trying to, obviously I'm a proponent of the vaccines because the vaccines are cutting down on cases and cutting down on fatalities, particularly in the older groups. But when you look at the numbers, when you see, for example, 6 cases out of the 6 million doses of Johnson & Johnson, and when you extrapolate that to 77 million just domestically, versus I believe we've had over 560,000 COVID-related fatalities so far across the country. Even in Montgomery County, we've had over 1,600. So just comparing the numbers, yes, we are concerned about these events, and yes, we'll continue to get information on there, but it's still a smaller percentage when you compare to the number of cases and the number of folks who have had severe illness and unfortunately had complications and died.
I would also add to that the number of people who are going to have secondary long-term impacts from COVID is very likely higher than any of the secondary impacts that we've seen for the vaccines as well. So COVID, in addition to having 560,000 deaths, this long hauler COVID, we're learning a lot more about that. And, the long-term neurologic and mental health impacts, for example, there was a wonderful study in the Lancet that we talked about, that we were looking at, a week and a half ago. And so there's plenty of reasons not to want to get COVID, even if you survive it. And so obviously getting vaccinated is, the risks associated with vaccine are far lower than the risks associated with getting COVID.
Absolutely. All right. We talked about a mass vaccine site earlier. Is Montgomery County getting fewer vaccines than the mass vac sites over on the Eastern Shore?
I don't think we know the allocations to the mass vaccination sites generally. We just know what our mass vaccination site gets, and we know what the county gets. And we know what other counties and other hospitals get, but I don't think we know how much is allocated to the mass vaccination sites other than our own.
Okay, that makes sense. And I know one thing was we have more people registered right now than we have doses to give, so we still want to encourage people to get registered as much as possible, so that we can keep that flow going.
Yeah, we have 135,000 people in our pre-registration list for the county level, and there are at least 65,000 people who have pre-registered and preferenced as their first or second choice the Germantown mass vaccination site through the state's portal. Okay. So, there will be some overlap between that 65 and that 135, but let's just say we have somewhere between 150 and 200,000 people in Montgomery County who are pre-registered in a system, have said they want a vaccine, who have not been vaccinated yet.
All right, thank you for that. Next couple of questions revolve around camps, summer camps. Can vaccinated adults, i.e. camp teachers, move between groups of children, assuming we have 2 groups of 25 campers in very distinct and non-shared areas? So the question as I read it is, if they're separated by groups of 25 and then you have vaccinated adults, can they intermingle in between the 2 groups safely?
So we actually received an email correspondence from at least one entity asking that question, and the team will be reviewing that and providing follow-up guidance that addresses that very concern, and we'll be able to provide guidance on how to move forward. So if that group happens to be the group that asked this question today, we got your email and it's being discussed internally, and we will provide follow-up guidance to you all.
Okay, very good. And
I think this is probably a good time to talk a little bit about the challenges of vaccine, the benefits and challenges of vaccination as it relates to activities. And so one of the key things, for example, I'll give you a good example. Right now, within the fire service, there's been a question like, well, all the firefighters in our firehouse are vaccinated. Can they stop wearing face coverings? Well, the in theory answer is that probably would be fine. But the problem is, do you know affirmatively that everyone's been vaccinated? Do you have evidence of that? Are they 2 weeks post-vaccination and fully covered? And oh, by the way, what if someone comes into the firehouse who you don't know the status of? Do you take their word for it, or do you not take their word for it? And if someone declines a vaccination and everyone has to put on a face covering, does all the other employees now stigmatize that employee who's chosen not to be vaccinated? There are a lot of complications. These are good problems to have as more people get vaccinated, clearly. But we're still waiting for some additional federal and state guidelines on how vaccination should impact behavior. CDC has given some guidelines to family gatherings and things like that, but there's a broader societal question about, as we get into 50% vaccination or 60% vaccination, what should that mean? We're thinking about these questions, but it's tricky because you cannot really know someone's vaccination status because it's a protected medical intervention for them. And so they're not required to tell you, number one. And number two, even if they do tell you, you don't have, like, the little cardboard piece of paper that you get when you're vaccinated isn't it's not a foolproof methodology for vaccination evidencing, because my 11-year-old with a printer could probably replicate incredibly well the vaccine card. And so it gets really tricky when you try and operate in this. And I see Sylvia's turned on her camera, so I'm going to bet she's going to have some comments on that too.
So the one thing that I would note is that employers do have a right to ask their employees if they have been vaccinated and to ask for proof of vaccination. However, in doing so, you have to make sure that you're keeping any protected health information secure and follow all of the necessary HIPAA guidance, as well as if a person is unable to be vaccinated for whatever reason, the employer needs to be willing to make an accommodation for that individual in the event that they're unable to be vaccinated, either because of a religious belief or perhaps they have a medical condition where it's contraindicated for them to be vaccinated. So those are just two additional things to consider.
Thank you, Sylvia. Ms. Kinch. All right, and right along the lines of that same conversation, Dr. Starter, you talked about CDC recommendations. You know, we've heard about the 3 feet versus the 6 feet. Are camps going to go towards the 3 feet of distance model, or is 6 feet still going to be prevalent? And a follow-up question to that would be, is camps open in July 26th? Do you believe that more information like we're discussing right now and more rules are going to come out over the course of the next 2, I guess that's 3 months away, that would allow for our audience to stay tuned and check for regular updates?
I can start on that, Dr. Yells. The 3 foot of distance is, there's a lot of fine print, is what I would say. And so the recommendation from CDC is that in a classroom of cohorted students, meaning students who are not moving back and forth between that classroom and other classrooms, intermixing with other students, you can have 3 foot of distancing in that environment. They did not, the guidelines pretty explicitly say it does not apply to auditoriums, hallways, buses, cafeterias. For example, if you have to take your face covering off to eat in the cafeteria, the 3 foot does not apply there. And so obviously the challenge that MCPS and the non-public schools have faced, and similarly others will face in thinking about this, is how do you allow 3 foot of distance, but then go back to 6 feet in every other part of the building, because the building wasn't designed to, it was designed for one ratio, not 2 different ratios that are applied differently in different environments. And so I think ultimately, so number one. Number two, the camps are not a cohorted environment like a classroom is, unless they're truly staying inside a singular room for the camp, in which case I don't necessarily think we could talk about it, but it really is only intended for the cohorting of students in a single classroom can go to 3 feet. And, you know, MCPS has already determined that it does not apply to their high schools because they, and their middle schools because they move between classrooms. And it does not apply in the cafeteria for the elementary school students because they're removing their face coverings. And so the short answer is it probably does not apply to your camp environment, right, but it's a lot more nuanced and complicated than simply reducing 6 feet to 3 feet. And I would encourage you to read word for word the CDC recommendations around this, because I think it'll be clear that it's a lot trickier than just reducing from 3 to 6 feet.
And I couldn't have said it better and have nothing else to add to that piece on that part. The other piece that I would comment on is just the second part of the question in terms of where we hope to be, where we will be, and what type of further guidance will come in the future. So let's be clear. We want to be in a different place in July. We want to be in a place where we have things far more open, where there are less restrictions and more activities to be able to happen. In order for us to get there, however, we have to continue to deflect the wave of new cases that we're seeing in other jurisdictions. So imagine right now, I know a lot of people are, based upon the email traffic we get in terms of why we haven't reopened to the level of other places. So imagine if Montgomery County's case rate was 40 cases per 100,000 right now. That would be an additional 300 cases on a daily basis, which puts us in a very different situation in terms of probably likely having to walk back provisions that we have now and to make sure that we're safe. So we're continuing the approach we're taking to try to beat out the variants and to keep our numbers down as we continue to get more residents covered and vaccinated, because then that shifts the conversation to a different place of, yeah, so how do we factor in when we've got all these folks vaccinated, what types of activities and provisions can we put into place? Now, we're hopeful that if we can continue to adhere to those, that guidance and those provisions, that yes, when we get to July and we've got 70%, hopefully, or even higher than that percentage of our population covered, that the numbers will be low and the level of activities that we'll be able to support or recommend to do safely will be significantly increased than what we could potentially offer now. Now, it's tricky to be able to predict that.
Right.
And part of what our team has been working on, when I say our team, the team who goes through and reviews the different proposals, when they've been meeting and talking with folks, is they've been real about that and to say, here's where we are right now, here's what you need to plan for, but also think about some best case scenarios and some contingency plans so that should we be able to increase capacity and be able to increase certain things, that you've kind of done some of that planning and have some of those ideas in place. Now, all of this is, I can't talk today, it's a Friday. All of this is fluid, however. So think back, for example, on March 8th that I mentioned, at that time, none of the counties in Maryland had case rates over 20, test positivities. I believe there was only one county who had a test positivity over 5%. Now, fast forward 3 weeks later, by that time, we had seen, I believe, 10 counties over 20. And as far as test positivities, numerous counties over, there were 8 jurisdictions over 20 cases per 100,000. And a significant number of places who had elevated test positivities. So things can change, things can change very quickly within a short window, which is why we haven't been promoting, well, things look good now, we can relax, or we can prognosticate that in July they'll look this way. So we just ask that you continue to be patient with us, continue to adhere to the guidelines. And I feel optimistic that, again, if we stick to what we're doing, continue to get shots in arms of our residents, we'll be in a very different place come July.
Thank you both. Very good answers. It all boils down to the behavior that drives everything. Last question about camps. For kids coming in each day to the camps, should the parents fill out the COVID questionnaire, or depending on the age of the child, i.e. a teenager, can they fill out their own COVID questionnaire?
I don't know if there's a legal element to that that Sylvia may want to comment on, but
I was trying to answer another question, so I didn't hear it. Sorry, what was it?
For kids who are coming into the camps each day, should the parent fill out the COVID questionnaire, or depending on the age of the child, i.e. if they're a teenager, can they fill out their own COVID questionnaire?
I believe that if it's a teenager, they can fill it out. Say over 16 is probably considered okay for medical purposes. However, parents are always the guardian up until the child is 18, or in certain circumstances, up until the child is 21. So I think that is just a decision that the family needs to make for themselves, if the child is responsible enough to fill out the attestation and reliable enough to fill out the attestation.
Could the camp get the parent to grant a preliminary approval to provide the attestation for the camp duration?
Yes.
So you could in the beginning say, is it okay if we asked your child the attestation question, which are these questions here, as they come to future camps? And the parent could say, yes, that's fine. And then you could ask the 13, 14, 15-year-old that you trust.
Right.
You feel confident will give you the right answer. Okay.
Exactly.
Yeah, sounds good. All right, let's keep it going. So given that Montgomery County is the only jurisdiction in the United States that bans the sale and or consumption of food in theaters. What is the justification for the ban, and when can we expect it to be lifted? There's also some information in here, as you can imagine, as to supplemental to that question about the negative nature and impact it's having on that industry.
I'll take a shot. I spent many of my formative years working in movie theater. I was a projectionist and manager for all the way through college. Regal Cinemas, actually. I'll even go ahead and name the chain. I worked in a theater 7 or 8 years, so I understand very much how much concessions mean to the overall business model represented by theaters. That said, really there are 4 key elements that we look at when we talk about the activities and risk. Is the activity indoors or outdoors? If it's indoors, it's higher risk. Are there multiple non-household contacts involved in the activity? The more non-household contacts, the higher the risk. Can you wear face coverings the entire time you're in there? Yes or no? If the answer is no, then it's higher risk. And finally, what's the duration of the activity? So how long is an individual or other individuals exposed to the hazard of the environment? And the longer the duration, the higher the risk. And so obviously the challenge posed by movie theaters is they check all 4 of those boxes. As the questioner surely knows, theaters have been largely closed for an extended period of time leading up to this most recent. And so what the Board of Health has chosen to do, and again, this is the Board of Health, this is a regulation proposed and approved by the Board of Health with the recommendation of Dr. Gales, and I provide some feedback as well, and others do as well. They make the ultimate decision, and we have generally recommended that they avoid things where you have to remove your face covering indoors for extended periods of time, as the risk profile is the highest there. Obviously, they have permitted indoor dining to proceed up to 50%. I would suspect that they may reconsider the question of concessions over the next several weeks to months. I should say weeks. I don't think it'll be months. I think obviously they've been monitoring the numbers. We've seen a slight uptick, and we're hoping that sort of plateaus and with vaccination starts to come down. And I would expect that would be one of the next actions you would see that the council would take in terms of an affirmative reopening. I think they're kind of, they're following our feedback, but I think that they'll ultimately eventually make that decision soonish. I just don't know based on the numbers whether it's going to be 2 weeks from now, a month from now, or so on. So that's I think the best we can give at this point.
Fair enough. And I'll just read a few more sentences from the statement just to make sure that it's not going to change your answer. I don't intend it to, but just to make sure it gets out there. It stands in stark contrast in their permitted food sales and consumption at bowling alleys, malls, museums, and restaurants, and regrettably serves to further extend the year-long stigmatization of theaters in the public eyes. To date, there's only 2 theaters open in Montgomery County. ArcLight Cinema in Montgomery Mall has announced its permanent closure. So it's like given the consequences of singling out theaters with restrictions that are far more severe than those imposed on almost any other business or activity, I think it's only fair that we get a justification, and that's what you provided prior to me reading the rest of that. Next question that we got in advance is actually the last one we got in advance, and I apologize, it is about campsites. So it says, as part of our annual campsite license application process, we already have an inspection and review, which last summer included a COVID protocol documentation. Does the requirements that just passed require us to submit our COVID protocols to an additional department or an additional portal?
I believe what we've said is, and Sylvia can correct me if I'm wrong, is that if you have previously, Sylvia, if you just want to answer, I'm happy to have you just answer. But go ahead, you're muted.
I'm scrolling through the order right now. Just give me a second.
Okay. I believe where we've said is if there's no substantive change in your proposal and we have previously approved it, we have generally considered it still approved. So, as long as it's, following the current guidelines, meaning you don't have to resubmit and have a new we haven't added a new specific thing. You don't have to redo it if you've already gotten it through once and you haven't changed the protocol. If you change the protocol, then you would have to likely resubmit. But Sylvia.
So the Board of Health regulation indicates that you have to have a COVID protocol plan that's approved by the health officer. Since there have been no real changes to what we want that COVID protocol plan to look like, it would stand to reason that a prior plan that was approved would continue to be valid. However, if you want to be on the safe side and have it looked at again, there is a group of dedicated individuals who are constantly reviewing them. You can state there's no changes, and since there's been no changes in what we want since last year, it seems pretty likely it would be approved again. But you should be fine sort of whichever route you take.
Okay, thank you. Is there somewhere where we can see the contact data tracing to determine what's high risk and what's behind the numbers?
That information is available at the state level, and I believe is the dashboard public facing for contact tracing data that we have here. I'm asking, or I don't know how that's shared for now.
I don't think we've posted the state contact tracing. I actually don't even. I don't think we could probably. I'll quick real pull it up unless there's an objection, because I think we can show it here. It's just there are some serious caveats to the data, and I think it's important. And I'll give that context as I share the most recent weekly report on the data, because I don't want it to be misleading. I mean, I think it would be misleading in a way that I think would be characterized as worse than it actually is. But I don't want that to be the case. Let's see. Let's try this here. All right. Can everyone see my screen at this point?
Mm-hmm.
So this is the last week, and this is sort of a summary of. So just to be clear about this data. So this is cases in Montgomery County resident cases. They asked them a series of questions about the activities they did in the days and weeks preceding their positive case. And they categorized them into two separate kinds of activities: high-risk gatherings and high-risk locations. I will draw you to two key, really important things to understand about this graph. First off, I think in the text right below where you see high-risk gathering, right below the upper box, you see percent of cases with greater than one high-risk gathering, 12%. That means that 12% of those 762 people have said they attended a high-risk gathering. And of that 12%, you see the bottom breakdown where it's family gatherings, sporting events, house parties, etc. Now, on the high-risk location side, 38% of people have identified a high-risk location that they've attended. And consistently, the highest high-risk location people visit is I work outside my household, and therefore. So working outside your household has consistently, from the beginning of the pandemic, been the highest risk activity that has shown up on these lists.
Right.
Now, what we do is we track this particular chart both against our cumulative chart, which we also get, which is the summary of all cases from the beginning, as well as week-to-week variations. And so, for example, we have seen as indoor dining when indoor dining was closed, the percentage of people reporting indoor dining, for example, was around 10%. So that was people probably traveling to other places where indoor dining was open, or going to an event that they classified as an indoor dining event. Now, as indoor dining has opened, that number has steadily increased. It was basically started out like 20% 2 weeks after we opened, and has increased 2 or 3% almost every week. So we're up to 28% now. Outdoor dining has started to increase because over the winter, there was no outdoor dining anywhere really. So outdoor dining was 3, 4, 5%. Now it's up to 16%. We see similar shifts in the contribution of activities. But I think these charts are fairly reflective of what we see and have seen for the last several weeks, with the notable increases. Actually, retail has actually come down a little bit as indoor dining has come up, which I think is just a weird feature of the data. But this is the kind of information that we get on a weekly basis from the state of Maryland's COVID link system. So I think this gives you some insight into the kind of reports that we do receive.
It was good information.
Yeah, go ahead.
No, I would say it was good information. Thanks for sharing it.
And I will share one other piece that we get quickly, and I think it's and the other piece of data that we typically get, I'm trying to apologize, this doesn't make for great TV. But I think it's important. Is this report, which is, this is a breakdown of occupations of individuals who develop COVID-19. So thinking about it this way, you see restaurant service workers here are about 9% of the cases identified as restaurant service workers. Now, that differs from indoor dining in the sense that a restaurant worker is not the only person in indoor dining. Obviously, there are guests, right? So just breaking down that the two charts show different things. So among restaurant workers, 9% of cases, but among people who said that they've developed COVID-19 who have attended indoor dining, that would include both restaurant workers. It would also include attendees of restaurants who have no work affiliation with the restaurant. And so this illustrates, you see consistently these two other categories have been other non-public facing, which is a accumulation of several different industries. Other public facing have been at the top. Construction and manufacturing has been consistently top 3, top 4. The big one obviously is healthcare has dropped considerably. Healthcare used to be around 20-25% of the cases because obviously healthcare workers are exposed at a very high level to people who have COVID-19 because people with COVID-19 go to be treated in the healthcare system. But now with vaccinations, healthcare workers have dropped like a rock in this analysis, whereas the other groups, the other categories, construction, restaurant, and retail, this chart looks almost identical to the distribution of cases, with the exception of healthcare workers coming down so considerably. Obviously, this is a week worth of data. This is only 762 cases. We look at the cumulative chart to see how is last week different from the cumulative. We look at the last week versus the week before that and the week before that to see trends. But obviously, this data is not perfect, and we don't pretend it's perfect, but it is an indicator often of trends and things that we should be paying attention to.
Absolutely, very helpful. Thanks for sharing those charts and information. A few more questions before we get you guys out of here. Are you advising a household and business approach to vaccination, vaccinate an entire household and all employees at a business to enhance safety?
We've had some exceptions. So the short answer is no, not globally, particularly in the earlier stages where the focus was on specific populations and groups related to age and types of employment. Now, as basically now the criteria is anyone who's over 16 can get the vaccine. I think it's a very different situation. The challenge is that even as more people are eligible, obviously, as we've talked about, the amount of doses hasn't increased to the point where we have an endless supply, so that even if you're eligible, you can get an appointment right away. And that's the thing we're trying to encourage folks to be patient is, yes, you may be eligible, but that doesn't mean we have an appointment and a dose to provide right now. So to that question, now that there is more broad criteria for eligibility, meaning everybody,
That's right.
we if there was a situation where someone did receive a vaccine, we would attempt to try to get everybody covered as quickly as possible. It also underscores right now, given that we are not in a place where we're doing walk-up vaccines or vaccines without appointments, for folks to pre-register as much as possible. Right. And I want to just break down a distinction between the two. So there have been reports of some jurisdictions who are doing walk-up vaccination. That's in large part because their demand is lower than the supply that they have, and they've opened up, particularly at some of those mass vac sites in other parts of the state. We are not in that situation yet. I think we still have 120,000 folks on our pre-registration list who have yet to get appointments. So we're still working through that, trying to get appointments shipped out to people. Now, we're building the capacity to potentially do that. And for example, some of our community partners that we will be working to supply doses to stand up clinics in different ways. Whether it's mobile or pop-up or in their actual provider offices. Now, they may actually implement some of those strategies to increase yield and penetration within their respective communities.
Okay, makes perfect sense. And so it seems like now that the youth will be available for vaccines, do we have a planned outreach for youth vaccinations? And is there any data that we have for the demographics of youth clinical trials?
So youth are not actually included. The only youth that are included are 16 and up for
Yeah.
Pfizer and 18 for that. So just to clarify that, Pfizer has actually put in a request for authorization to use their vaccine down to, I believe it's 12 years old and up. And they're continuing to do clinical trials for younger groups. But right now, we don't have any authorization to use those doses below the age of 16 for Pfizer and below 18 for Moderna and Johnson & Johnson, should we go back there. They are working on it. And that's the only only the Pfizer application is the only one that I'm aware of that has been requested so far. I don't believe there is a formal hearing date for the FDA to review their application indication. Though that said, we're not waiting for that to think through and plan that. There's been some thoughts thrown out about potentially utilizing the school systems and partnering with the school systems to do that. Again, we're in a situation where we simply don't have enough doses right now to do that.
Right.
But hopefully, once we can get some of these issues with manufacturing and safety procedures and protocols fixed, there will be a windfall of doses, and we'll be able to potentially utilize some of these places and venues that young people do go to and frequent more, or are trusted places, to be able to increase outreach for them.
All right, thank you a lot for that. This is going to be the final question. It's kind of a big one. We'll try to see if we can get us a quick answer for it. So for business and economic expansion, do you have some guidelines or expectations about need for specific and or increased liability insurance for businesses who establish COVID-19 vaccine requirements or protocols, including sports teams, nonprofits, and providing volunteers?
That's a big question, and I'm going to say, fortunately, from the public health response, I have a small contribution to that answer, being that is outside of my purview, so I will defer to others to answer.
I thought Sylvia might have an opinion on that one, but maybe not.
So I don't. I would say that I think you need to talk to, if you have legal counsel or perhaps your insurance carrier, to figure out what is best for you and what the current industry standards are with regards to COVID and liability insurance.
Thank you. Appreciate it. The very last thing I'll say is we did receive one comment, and it says, since we normally spend these sessions complaining, I did want to also offer a sincere congratulations on the good work narrowing racial disparities in the county. Thank you for your hard and worthy work. That was related back to the Washington Post article that was published recently. So congrats to everyone who had a hand in that, which I am sure includes everyone who I have spoken to today, and Dr. Gales, Dr. Stoddard, and the great Ms. Sylvia Kinch. Thank you for your time. The answers were great. I am sure a lot of people got a lot of good information from you. We do appreciate it. As always, these conversations would not be nearly as healthy or productive without your input, and you guys take the time out of your schedule, and we all know you're very busy. So I'm very grateful on behalf of everyone who listened. I'm sure they're grateful as well. We will say, we will wrap up right here. Our next session should be on maybe April 30th should be the next day that we meet with the Recovery Town Hall. So until then, we will say goodbye and thank you for everyone for joining in today. Take care.